Okay, I wanted to clear out this camera and start fresh, but anyway, don't ask me how this strobe light that's been sitting here for years turned itself on. Okay? Like, I caught something flashing from the corner of my eyes. I'm like, what the hell is that? I'm afraid to touch it. But I'm pretty damn sure this is a freaking strobe light. Don't ask me how it got turned on. I don't even know where the turn it on and off button is. Like, that is the weirdest thing. Like, literally, it turned itself on. Can you see how deep it is in there? What the heck? My lord. I haven't used this thing in years. Like, we're talking years. I don't even know how to turn it off. Like, literally, I don't. I don't even know how it turned itself on. Imagine that. It must have a little switch or something. It's plugged in, too. Yes. My lord. How did this happen? How many plugs does it have? One. Right here. No. There's no switch on it. I don't even remember where the switch is on this thing. Come on. There's gotta be a switch. Right here. Look at that. Today of all days, this thing turned itself on. Well, that's kind of spooky, don't you think? What you telling me? Why would a strobe light turn itself on? Okay, so today's, I think, the 25th of September of 2022. I have time now to jar up this lard. This is pork fat, and then after that, then I'll do the beef. There was more pork fat this time than there was beef. So, anyway, what was at the bottom of the bowl, right, is in the fridge, and I'll just fry some potatoes with it or whatever. And that's just a little bit of the lard with a little bit of that gelatin, okay? There was very little gelatin. So, anyway, this is basically lard that I'm now melting, but before I jar it up, just to be double sure, I'm going to strain it. Okay, so I'm not going to heat it up too hot, right? Just enough to melt it, to be able to pour it, and then in that pot, I'm going to heat it up to almost a boil, right? And then put it into hot jars, which are in my convection oven, at about 225. Put your lid on, turn it upside down, leave it like that 15 minutes, turn it over, and then more than likely your jar will seal. I prefer to put mine in the fridge, but if the jar is sealed, technically it should be shelf stable for several years. But I still put mine in the fridge, and then the tallow, the beef lard, you have to freeze. So hold on. Okay, now this is exactly why we do this. Do you see that? Okay. Alright, now we know it's nice and clear, okay? Because it's been strained again, right? In terms of just double checking, right? You can see that, right? Okay, so I just want to show you the difference in terms of even a little extra heat. Because I jarred up these 4 jars first. Look how nice and clear it is. Nice and clean, right? Well, it's not that it's dirty, but... Right? And then, you know, I turned down the heat so I could, you know, screw on it, right? Get new jars, right? And by the time I got to the last little bit, look at the difference in color. You can see. This one's slightly darker, right? So you have to kind of work fast, eh? And try not to turn up the heat too much. So after you've done this... It looks like I could have added a bit more in there, but obviously with my eyes I don't see the headspace as well. But besides that point, I added a little more in these ones from what I can tell. So after you get your lids on now, because you're trying to seal the jars, I would recommend using new lids for this. Now these ones will go in the fridge, and I spoke to you know, the fellow who gives this stuff to me, right? And I did ask for more pork fat. What's going on with this camera? Was something wrong? What's going on? Oh, was that my hand? Sorry. I did ask for more pork fat and maybe pass on the beef for a little bit, right? Because, you know, you have to freeze the beef, right? Okay, so in a couple, 2-3 weeks, I'll probably do this again, right? Assuming I can see. I'm sorry, people, it's just the reality, right? And then I'll probably do another batch of beef, because don't forget, I'm getting the crackling from it as well, which I'm bagging up into little baggies, and I'm freezing that, because the beef crackling, oh my God, is so good, right? I like the beef crackling more than I do the pork crackling. Like, it's so good, you can't imagine. So, I'm definitely going to do beef again, but, you know, like, I'll see what I get in another couple, 2-3 weeks, right? Do whatever he gives me, whether he gives me just the pork fat or whether he gives me the beef and the pork fat. After that, I'll probably kind of slow down on it, and in terms of the lards, right? And, you know, when I look back at my videos, and I try and isolate when all of a sudden everything went really cloudy, when I did the ghee, people, I could see. I mean, I always, obviously I've had issues, right? We know that, right? But the cloudiness is the bigger issue here, right? In terms of, you know, kind of making me go blind, And when I did the, see, when I heated up that last little bit of lard, I brought it too high. I should have just left it where I had it and just continued jarring up. But because I can smell it, right? So just be aware that the less you can keep it at high heat, the better off you'll be, right? You just want to bring it up high enough in order to be able to seal the jars. Okay, so anyway, when I was doing the ghee, you know, I did 3 different batches, right? 3 different ways, right? With 3 different types of butter. Bought butter, homemade butter, and different, okay, and, right, with whipping cream. Okay. Anyway, 3 different types of ghee, and I could see what was going on in the pot, right? Then, that shenanigans at Debbie's house occurred, and I could still see pretty good in terms of it wasn't, when I went outside, I don't recall it being extremely cloudy, right? But soon after that, because that was, that shenanigans at Debbie's house was like April 22nd. I made the ghee pretty much right before that. And then by the 27th, when Tisha took me to the bank, that was it. I got in the car, and it was cloudy all the way. And it hasn't gone away since. So I'm like, I was in here the other day. What was I cooking? Something with the big pot. I probably did a video on it. I don't remember what it was. You know, because I'm still doing food prep, right? And with me standing over the pot, I'm having a great time here, aren't I? Greasy hands and all. Oh my lord. Anyway, this isn't working, people. It's not working. Anyway. What is that? Where are my knives? Anyway, with me standing over the pot, it was the big pot I was using. What was I cooking? I put it in the freezer. Corn and all that crap. I don't know. I was using... Anyway, not... The heat. I could feel it in my eyes. And like... I'm wondering if maybe when I did the ghee, just the oils and the heat and... You know, but now, mind you, I looked up glaucoma, late-stage glaucoma, and all that, right? And, you know, being that I've had it for 20 years, and basically it's been untreated for the last, well, for a long time, really. 3-4 years. It accelerated. And, you know, and it's not like I didn't try, people. Like, for the last year and a half, 2 years, I phoned around, but with this COVID crap, people weren't either answering their phone, like eye clinics, they either weren't answering their phone, or they weren't seeing anybody, or they demanded that you wear a mask, right? Or they wanted you to pay, like me to pay, because they didn't take social assistance recipients, right? Or they said they'd call me back, and they didn't. And then when I called them back and finally got through, they said that they couldn't do it. Then eventually I just broke down and went to that eye clinic because so much time had passed. And then they let it hang for 5 months because I went on April 31st. They told me that they were going to do the referral that day, but they didn't. And then 5 months dragged by to where we are now, to which I'm being told by emergency staff that the prognosis is poor and that it's going to be what it is in terms of it won't change. If anything, it will get worse. But I'm just like, I'm wondering what instigated it, right? In terms of like, kapow. Was it because I was standing there doing ghee? Or did I get contaminated with something with that SWAT team sitting out my front door, unscrewing my light bulbs and moving my chairs and, you know, just contaminating maybe something. Who knows? Or maybe it was somebody else that contaminated something and I touched it and went like this. One time, one of these envelopes came in from the government and I opened it up and oh my God, it smelled so bad, people. I don't know what the hell they had inside of it, but it was disgusting. I just didn't say anything about it. But for all I know, maybe they put something on their paper and I'm touching, and then, you know, I go like this. Who knows? Anyway. So, the last little bit here, I overcooked it because I can see there's a slight difference in color. So, just be aware that you don't want to heat it up any more than you have to, okay? Because you can see this was the first batch, this was the second batch, and obviously, you know, alright, but that's okay, it will still be fine. Now, I'm going to let this cool down for, well, I'm going to leave it like this for about 15 minutes or so, then come back, and we'll wipe everything down, because it's greasy now, right? And I'll flip everything over, and then I'm going to wash the pots, right, get a new strainer, I have one somewhere here, with a new cheesecloth, right here, you can see, for the beef tallow, and I'm going to do the same thing like I just did. I'm going to do the same thing like I just did with the pork lard. Now, I have aloe vera that I've been putting in my eye. The juice is in the fridge. Plus, I decided today I'm using those old drops because I know I'm going to be going to see an eye specialist soon. Right? So I figure by the time I get to the eye specialist, those drops are either going to show a difference or they're not in terms of the pressure. Right? I know they're old, but I'm sure they're okay. Right? In terms of, I don't think that they're like, you know. Because if they work, then he can just give me the same prescription. The only thing is, I won't get the generic kind because it's too hard to squeeze the bottle, and I'm really having a hard time doing it. But I don't want to go see the eye specialist, and then, you know, he's going to tell me, well, you need to come back in a week or two so that we can see if your eyes are like blah, blah, blah. Whereas if I just use the drop, I can tell him this is what I've been doing. He'll tell me whether it's working or not. More than likely it will work. And then he can prescribe the proper, like the main, not the generic, okay? Like whatever equal is to that. And I'll have to pay for it in part, right? I have to pay like $40 or $45 per bottle, which is kind of expensive, but at least I can use the bottle, right? But I'm not out of the woods yet, though, people, because I'm going to have to go get another referral in 6 months. I mean, then I have to, what, face my family doctor? You see, that's the thing. I can't go to the clinic and just get a random doctor to give me a referral. It has to come from the family doctor. When I went to the hospital and I told them, like, well, they said, well, still Dr. Fasinski, your family doctor? I said, yeah, you know, but, you know, it's not like we get along or talking. They said, well, do you want us to take him off the file and not send the records to him? I said, no, send the records to him. Because where else are they going to go, people? Like in terms of my visit at the hospital. Where else do my records go? Right? Like, how do I face this man? Oh, I'm sorry. I need to get a referral for this, and I need you to do this, and this needs to be done. And yeah, in the back of my mind, I'm still thinking about taking your ass to court one way or another. You know, whether I call you in as a witness or whether I fucking take you to court directly for fucking over my fucking eyes and my fucking life. Excuse me for boo-boo swearing. But, you know, I mean, like, you don't, what was I supposed to do, people? I phoned up different clinics. They weren't answering their phone. They were telling me that they couldn't see me. They were telling me that I had to wear a mask or fuck off. They were telling me that I had to pay or fuck off, right? You know what I'm saying? They would say, oh yeah, I'll call back, and then, you know, they're going to call back and they wouldn't call back. Like, or they just couldn't see me. Like, and then when I do finally get to a clinic that's willing to see me, they screwed me over for 5 freaking months. Like, you know, it's bullshit. It's like total bullshit. So I don't know where I'm going to get my next referral from. I suppose I can go to the clinic and pay for the exam to have them to give me another referral, but we know how that worked. It didn't fucking work. I went to the clinic, the eye clinic, to get a referral. The referral never came in. So how do I face my family doctor? I can't find another family doctor. It's not going to work. It doesn't work. It's not like that out here in British Columbia, Canada. All these doctors are already booked up with their patients because the government caps them off with an X amount of number of patients. And once they meet their quota, that's it. They can't take any more patients. And if they're willing to take patients, they want to do a meet and greet over the telephone or a meet and greet on the internet or something. I'm like hooped. I hate British Columbia, Canada. It is so corrupt. So corrupt. Tammy said something to me on chat there, on message board. And I said, you know, in regards to Brooks, right? Like, you know, like, it's not like the cops are going to come here to my house and tell me that they assisted my son into assisted suicide and that he's dead now. They're not going to come and tell me that, people. That's murder. Oh, well, yeah, your son's dead because he wanted to die because he was depressed. Kind of like Shimei, you know? So we just helped him to do it, and we just thought we'd let you know. We didn't have to tell you, though, because of privacy rights. I could see them doing it, not telling me on purpose, and then trying to hide behind, quote-unquote, privacy rights. It was a private right for my son to choose to kill himself with the assistance of dirty cops and dirty healthcare staff, okay? And we damn well know what happened to his organs if that happened to him, people. And the last couple times I spoke with my son on the phone, he was quite depressed and sounded like that maybe he was going in that direction. And with these ghouls and goblins out here, they'd be more than willing to ethically kill him and then pillage his organs after he's dead, assuming they didn't take him out while they were killing him, in terms of him still being alive. Like, what kind of fucking province is this, people? Like, who talks like this? Who has to go through this kind of shit? Who has to think about this from child to child to child? What, Uncle John, Shimei, Sierra, and now Brooks. Okay, people. So I'm like, okay, well, how can I figure out whether my son's alive or not? Who do I call? I don't know who to call. I don't know when I should start calling around. I mean, he could be in jail. I don't know. But the way he was talking, people, I don't think so. I don't think so. I could see him getting all, and then they arrest him and take him to the hospital and fucking kill him. I could see that. That's what British Columbia, Canada has come down to. Because he'd be crying, oh, I don't want to live no more. I'm so depressed. You know, just kill me. Just kill me. So they got him all strapped up and they just freaking kill him. If they're not operating on him first before they do it. Taking out his organs, because you know they're going for their freaking organs, because why else would they be killing people legally, and then not go tell the parents or their loved ones because the patient said don't tell mom. Yeah, okay. With them saying, well, you can't have his medical records because it's his privacy, even though we killed him because he asked us to. Like, how fucked up is this? This is real, though. This is what's happening in Canada. And BC is leading the way. BC is leading the way. Wow. Because there's something else out here that cloaks itself as a human that's not human, people. Something else. Although humans are benefiting from it because, like, Punjabis, for example, I didn't know this, but I heard some shit on the internet with them talking about the Punjabis are dying left, right, and center in India. A lot of Indian people are dying. Well, we know why. Right? But they're blaming it on Indian people from India, Punjabis, whatever. They tend to get heart problems in their 50s. 30s, well, 40s and 50s, so because of that, they tend to have heart attacks and have earlier deaths because it's something genetically wrong with them, right? In terms of their heart problems, right? You know, just how some people have diabetes and that kind of stuff. Well, you know what? There's a lot of Punjabis out here, people, and there's a lot of death out here. So you put the two and two of them together, right? You know, these 50-year-old Punjabis that got heart problems, you can guarantee that they're capitalizing off of the death of the mayhem that's going on in this province with the young people dying, okay? And Brooks could very well be dead now, too. And they're not going to just... What did they do with his body? What, they're not going to phone me and tell me that they cremated it?
assuming that they're even cremating bodies. I don't think they're cremating every body out here, people. I don't think Shimei's body was cremated. I do not think so. No. I do not think so. But what would they do with the body after they killed somebody in a hospital setting because the person was depressed and said, I want to die, help me die? Because that's basically what it's boiling down to now in British Columbia, Canada. What, they're not going to phone the mother and let the mother know that they got a dead body on their hands and they don't know what to do with it? Or do they just take it upon themselves to do what with it? Literally, what did they do with Brooks's body? I'd like to know. Not that I'd ever get the truth from them, because they don't know how to tell the truth. You see, that's the thing. So I'm trying not to get bent out of shape. Right. But over the next year, if I don't hear from him, I'm going to have to go seek the truth. I'm going to have to find something. I'm going to have to go look and see, find out, figure out. Assuming that I don't go completely blind, because the blinder I get, the easier it is for my government to continue to target my family and do the things that they do, because, we're all depressed. Yeah, we're all depressed. I wonder why we're all depressed. Yeah. They basically evicted 5 children, a blind man, and a woman out into the frickin' streets in 2003, in the middle of winter, from a home that they had been living in for 8 years and were happy. And then they wonder why, over a period of years, we're all so depressed. Not to mention Andre being illegally apprehended, Sierra being turned into a literal junkie and a prostitute that was exploited out in the streets for 8 years, then lured to her death, with Shimei being murdered, with the cops standing there fucking supervising the cover-up of that murder, people. And then coming back with their song and dance, oh, well, your daughter was depressed. She killed herself. Yeah, I suppose Brooks was depressed too and killed himself right there in that fucking nasty hospital. What, were the cops witnessing that too? Or did the cops just take him there and drop him off and made it easy for them to do it? Because that's what's happening, people. It's all done through legislation. Federal and provincial. They had a hospice out here. Laura Lynn Thompson was doing interviews with them, and they had been around for a long time, and they fundraised and had a $20 million building that they owned, but they were getting grants from the provincial government to run the facility to help people in their last days, and they disagreed with assisted killing, assisted suicide. They didn't want to participate in that, and they tried to fight it, and the government ended up going in there and shutting down the whole place and took over the building, people, because they refused to kill people, even though the people were dying, and it was just a matter of time. Right, but they wanted to give people that, quality of care, right up until the end kind of thing. It was stupid. That was like a year and a half ago. I bet you they're gone now, because the government is hell-bent on killing people out here by any means fucking necessary, because there's too much money involved when it comes to their organs and shit, people. Not to mention the snuff movies, and not to mention the bodysuits that they create with their little electro pads underneath the skin. Okay? Seen that with Shimei. That's why I don't think she was cremated. They were doing something under her skin, people. You think they're just gonna go and burn that up? Hell no. They're gonna wheel her off and go do something else to further their experiment, okay? And now they've got people willingly saying, go ahead, strap me on a table and kill me because I'm depressed. I have no reason to live because I'm depressed. Oh, no problem, Mr. Chorney. We'll take care of that in a heartbeat. And then they took out his heart and gave it to a Punjabi who paid for it. I can almost guarantee you that. With the numbers of Punjabis that live in this province, with many of them with heart problems by age 50, oh yeah. And that's just the heart. Anyway, I definitely heated up that last little bit, just a tad bit too much, but it will be okay.